Welcome to Kenton's videos. Enjoy the video.
Dipsalic F is a topical ointment for inflammatory skin conditions. It combines keratolytic and anti-inflammatory actions to ease scaling. Read your prescription and follow clinician directions closely. Avoid use on the face, groin, or underarms unless directed by your clinician. Do not apply to infected, open, or bleeding skin without medical advice. Inform your clinician about allergies, pregnancy, or breastfeeding before you wash and dry the affected area before application to remove creams and debris. Apply a thin layer once daily to the affected area. Use one fingertip unit for each 2 palm-sized areas of skin to avoid excess. Gently rub in until the ointment disappears. Do not overapply or use occlusive dressings unless instructed. If treating hands, leave the ointment in place. Otherwise, avoid covering the area with airtight bandages. Limit continuous use to 2 weeks unless your doctor advises longer because prolonged use increases steroid risks. Wash hands thoroughly after applying the ointment unless treating the hands. Monitor the treated area each day for improvement or adverse effects. Stop use and seek care for worsening rash, spreading infection, fever, or persistent pain. Report any skin thinning, stretch marks, or unexplained bruising to your clinician promptly.
Thanks for watching. Consider subscribing if we helped you.